his legacy excels way above people that will have way more money and can do way more than he can. But he's doing what he can with what he got. So even though I think Luka Doncic is a bitch, I'll cheer for him on Friday. Clap it.
NANI?
Dynamite! 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 Dynamite!
All right, let's get into it. Hey, what's going on, everybody? How you doing? My name is Cheryl. This is that dating booth. Hey, if you don't mind, like, share, subscribe. Goes a long way. We're almost to 1,000 subscribers. Y'all see that? 872. We're about to hit 900. Remember the good old days when we were like at 300? Wow, time flies. I want to talk about Mark Cuban, not only because he was at Afrotech this year. Clap it up. Where's my clap button? There we go. And he was talking about, the importance of innovation in tech, and sort of like he gave the speech like, when black people are given the opportunity to truly express themselves in our society, the society improves greatly. He talks about these great inventors that come from the black community, and how when black people were introduced to NASA, we won the race to the moon, or whatever the hell we were racing for back then. And when black people were allowed to take part in our social engineering, the union busting and all of that stuff went away because they had the black vote to help keep unions together. So I found his speech to be riveting, also very satisfying to hear someone outside of the black community speak about the wanting and needing black people in business, especially when it's a person of Mark Cuban's stature, who has a known track record for looking out for people in a lot of communities. And one community he's taken a vested interest in, and enough to lose money in, is the pharmaceutical company. Now, the pharmaceutical company ain't no motherfucking joke. As a person who works in oncology, I could tell you, these motherfuckers don't play. The amount of money they use is both baffling and promising to see. But there are certain things that just should not cost what they cost. The fact that insulin cost is so expensive, and that our congressional government, our Senate and our House, couldn't agree to make it to stop price gouging of a disease that is I believe it's the number two disease in the country. No, it can't be number 2. Diabetes. But I know it's up there. Somebody give me the stats on that? It's up there. And when the creator of insulin died, he sold it off. He sold it off to a company, informing them that he's giving it to them for $1 so that they could mass produce it for everyone else. They patent that shit and and now charge $300 for it. So it's crazy that it took this billionaire to do this. And I don't understand what his reasoning is behind it. The store has gotten magnificent reviews, and basically what they do is take these generic versions of these drugs from out of the country, and they kind of just third party. He's the middleman. He's the middleman. He's like the Amazon of the pharmaceutical company. And I've tested this. I've tested this with my own medication. I've tested this with other people's medication, and it's fascinating, the results. The drugs and the consistency are equivalent in my eyes. But I wanted to know more, and I also wanted to give him a platform to talk about it. So let's hear from the horse's mouth.
One is with healthcare. And so probably 2017, when there was a lot of discussion when the Republicans got into the White House about getting rid of the ACA.
Thanks, Keisha.
There was a big question mark about what would replace it. And so I was talking with various people in the administration, and they were like, well, if you have any ideas, let us know. And so I started looking at, what could be created to replace the ACA. So I started funding these studies with various economists to just look at.
And keep in mind, this is such a brilliant statement. During the transition of the Obama administration to the Trump administration, the primary focus was to get rid of the ACA, the Obamacare. And that's when his mind triggered to say, there's going to be hundreds of thousands, dare I say millions of people who will not have health care. How can I help? This is, I don't know if Mark Cuban has any skeletons in his past, but if I'm just judging him off this moment, his mantra, his aura, his legacy excels way above people that will have way more money and can do way more than he can. But he's doing what he can with what he got. So even though I think Luka Doncic is a bitch, I'll cheer for him on Friday. Clap it. I'm not beyond reproach. I'm not beyond reproach.
At what are the underlying costs of healthcare? And around the same time, I got a cold email from Dr. Alex Oshmayansky. And he was telling me about the pharmacy, the compounding pharmacy he was creating in Denver that was looking for funding to be able to create drugs to handle shortages of drugs. So very often drugs, even generic drugs, go in short supply. And when that happens, either somebody jacks up the price or it just is not available or very difficult to get. And so as we were going back and forth via email, I started asking questions, well, why stop here? And that was when Martin Shkreli was doing his thing and he was going to jail. And I was like, well, if this idiot can jack up prices 1,500% or whatever it was for Daraprim, that means there's fungibility in the pricing. There must be an opportunity to reduce the cost as well. Can we look at that? And so that's where we started the process of working together to say, okay, what are all the regulatory issues? What are all the pharmacy issue, all the things all the I's you have to, the dot and T's you have to cross just to be in this business. And that took about 3 years. And we finally got to the point where it was, okay, let's start working with a drug called albendazole, where we had somebody manufacture it for us. And what albendazole is a drug for hookworm, for parasitics. And it's still a problem in rural areas of Alabama and Texas, South Carolina, and other places across the country. And it costs $200 per course. And I was like, well, if we manufacture it or have somebody manufacture it for us, what could we sell it for? And he was like, $12. I was like, okay, that's an indication that maybe there's something that we can change here.
And there's going to be a reckoning. And most people think like the reckoning is going to come from voting rights, racism, like civil rights. I think it's going to come down to either health or clean drinking water. The moment people can't afford to stay alive, you're going to have a reckoning. Because to see that some medicine costs $25,000, Kenny, that shit is wild. But I don't even know. I saw a post the other day on TikTok and it made perfect sense. A lady, they were like at a radiology. Hey, radiology is so much fun. Come on down. Like, this is how cool our system is. We hit a pin. We hit something on a bunch of apples and put them in our MRI machine and look. We can pinpoint with exact accuracy without ever seeing how many apples there are and know which apple is holding it. And it literally smash cut to a lady showing her full bill on the thing from that same radiology department and saying, I have a bill for an x-ray for $9,000 from this clinic because my insurance wouldn't cover it because they said my broken ankle didn't need an x-ray. And that's just the TikTok. It's an unfathomable amount of greed that is suffocating this country, especially for healthcare.
And so we went through the process, working with Baylor School of Medicine and I think it was their health sciences group, and had somebody manufacture it for us, went through the whole FDA approval process. worked with a bunch of clinics where we provided to them a cost and then started selling it as a cost plus drugs branded drug. And we learned some things there and said, okay, now it's time to expand. Can we go and work with a bunch of generic manufacturers to offer as many drugs?
I would
as we
love to
possibly
work
can?
under
And that
under
was
him
the
and learn
genesis of where
his,
we are
the way
today
his
with
mind
cost-plus
works.
drugs. We partnered with a company called Truepill, who's been great to work with, where they help provide software and build the website and all that, and became our dispensing pharmacy. And that shortcutted a lot of the dotting the I's and crossing the T's. And in January of 2022, this year, we launched our website and started shipping about 110 drugs. And from there, we've grown to probably 900, by the time people see this, 950 of the top 1,000 generic drugs that are available that we're offering on cost plus drugs.
Mm-hmm. And you have about 1 million people on board already.
Yeah, so we're adding anywhere on a weekend, well, now it's changing by the day, but let's just say 5,000 to 10,000 people per day. And that number is
That's
going up like
fucking
this. All our
awesome.
numbers are going up like this, like a hockey stick. It's incredible.
I don't think a lot of people know that this is something that you've been working on quietly for years now.
Yeah,
It just
yeah.
kind of popped up.
No, it didn't just, okay, let's just launch a
It's just
website.
me or does
Because
she have a
you've
really
got to
big head?
get, before a
it's well
drug
put together.
manufacturer,
It's just a
whether it's
big
generics or brand, is going to work with you, they have
Maybe
to
it's the
trust you.
teeth.
And they have to believe you're not going to screw up their business, and you're going to create more demand, and you're going to take care of patients and do it the right way.
The only thing that's kind of concerning about this process that he's doing is it sustainable? That's a big question, because he's operating at a loss right now. So when and where would he make the money to offset this? And I guess the thing that I'm thinking about is he's making these pills at cost price and selling them only, I think, at a 15% hike. A 15% hike isn't enough to sustain a business in this capitalistic system. So what is his game plan here? Does he plan to offset it with his own wealth? Does he plan to outsource this? It's troubling to see this, but I want to keep an eye on this. I will applaud him for the effort. It goes without saying, it's a strong effort. What do you guys think about this? Like, what do you think the catch is? While there's none to be visible right now, you know it's coming. But kudos to Mark Cuban, and keep up the good work, bruh. Luca ain't a bitch. I promise you. He's cool. He's cool.